Good Monday nights to you. I am Thabo Mdluli, and thank you for joining us tonight on the Newsfeed Late Night. Liquor laws in the Western Cape are set to change as the local government aims to curb alcohol-related harm and improve the efficiency of the Western Cape Liquor Authority. How will these amendments directly affect communities, and also what impact will this have on the alcohol industry, which is still reeling from the various bans during the lockdown? Well, we'll have that conversation. Joining me to discuss that is the Western Cape Premier, Alan Wendy, but also we have the alcohol industry representative, Lucky Ntimane, and the Director of Alcohol, Tobacco and Other Research Units at the South African Medical Research Council, Professor Charles Perry. To be a part of the conversation, you can tag us on Twitter at Newsroom405. You can send us your WhatsApp questions and comments to 072 110 5584. Gentlemen, good evening and thank you for your time tonight.
Evening. Good to be with you.
Good evening, Mr.
Good evening, Thabo.
Let's start with yourself,
Evening, Thabo.
Prof. Perry, as well as Lucky Ntimane. I'll start with you, Prof. The last time you were here, Lucky Ntimane accused you of having never visited a tavern in your life. You obliged because, of course, you're a man who's seeking consensus here and want the temperature to be lowered a little bit. You agreed to go to Gugulethu. What was the gathering about in your view when you sum it up?
I think it was a dialogue. We went to visit a liquor outlet, an off-consumption outlet, and we had a conversation there with colleagues who are involved with the Western Cape Liquor Traders Organization, Tavern, and the person who owns the off-sales, talked frankly, and then we went to visit one of the taverns in Gugulethu and spoke to one of the patrons there and the owner of the tavern and watched how things work. So it was a productive dialogue, and it was good to get beyond the animosity. The last time we were on your show, we both sort of wanted to put that behind us.
Indeed. Since the dialogue, did it expose the gaps in terms of the understanding as far as what strategies should be pursued to curb the harmful use of alcohol in the context of the township? Because I think that is where you parted ways with Lucky to say, but you cannot come up with these strategies for a township setting where you do not understand the dynamics of tavern owners, maybe even other outlets which might not even be able to meet the criteria of being licensed that are selling in townships. Did it expose the gaps?
Yeah, I mean, it's probably at least 8 years since I've been to a township to go and see a tavern. So I think it's helped me to understand the environment a bit better in which trading takes place in both those kind of environments. And the pricing structure of alcohol is different for off sales versus on consumption sales. And also the issue of unlicensed outlets, which is a very thorny issue, which I'm not sure the Premier's got all the answers for, but maybe we can give you a few more based on the meeting we had. But certainly there does seem to be, there's the relationship between the off-consumption outlets and the unlicensed shebeens. And I think, it's useful to have dialogues about what might work. I floated some ideas with Lucky and the others around, issues around standard drinks, what they are, around whether we could do better around tracing illicit products, around minimum unit pricing and things like that. So it was very useful to get their views on that, and even some of the practical challenges related to some of those things.
Okay, before I let Lucky into it, a complete alcohol ban in the past, in the future, considering that a third wave is coming, would it be ill-advised? What's your view now that you've been to Gugulethu?
Well, I think we need to try everything. And I've been saying that since before the first liquor ban was lifted. I said, I think we need to be planning so we don't do this again. And I'm delighted that the Premier is with us today because, I mean, the province has a very far-reaching alcohol harm reduction strategy. So it'd be great to see if we can get some of those things moving. And certainly the changes to the Act that he's got in mind, I think will move things forward. I think there's more that he could do. And I think we should do this. I think we should only resort to a full ban if we don't try anything. And I think we need to do better than just what we did in June, where we provided selling for off-consumption only. I think we need to look at tweaking it, and we've got to have those discussions and see if we can avoid a full-scale ban in future.
Right. Lucky Ntimane, welcome and thank you for joining us as well. So, did the dialogue for you, I suppose, come up with what you would have wanted to happen, right? The one thing that you would have wanted to happen by bringing Professor Charles Perry to Gugulethu to see it on the ground and how it works and what the concerns are for the tavern owner, which we'll get into in just a moment. But did it achieve that?
Thank you, Mr. Mdluli, for the opportunity. I really appreciate it. And good evening to the Premier and also to Prof. Perry. I'd like first to highlight, the fact that the passions that ran high on our last engagement with Prof. Perry were based on the strong commitments that we have for our constituencies and for the good work that Charles Perry continues to play around the public health. So it was not really based on animosity. I think what the dialogue did for us, and maybe I must declare that there was no tea there, is that we were able to open up and be able to have conversations that really sought to get into the bottom of what really is the driver of alcohol abuse that you see in our communities. We are equally concerned as liquor traders to ensure that our trading further supports government's efforts in fighting against the COVID-19 pandemic. We will not really be able to sit in a corner and watch our country decimated by those that continue to abuse alcohol. Ours is to find ways, find common ground in a collaborative effort to ensure that we come up with ways and means that will ensure that we tackle this pandemic of alcohol abuse that seems to beset our country. So the opportunity to meet with Charles Perry was something that we welcome, and the Western Cape Liquor Traders Association also welcome that engagement.
Yeah, like, are you planning? Are you planning ahead for a possible third wave complete ban of alcohol?
We are planning ahead to ensure that we avoid the third ban on alcohol, and this means that we need to have programs in place that ensure that we tackle the issues of non-compliance around liquor traders, especially taverns and bottle store, and ensure that we call on the knowledge of Prof. Perry to ensure that we implement some of the ideas that he has in mind to ensure that we avoid the third wave that will result in a ban. We really cannot afford another ban on alcohol.
All right. Premier, I'm bringing you in here as a mediator because the last time we had the two gentlemen, it got really heated, and I know you were not a part of it, but today you are the middle ground here. You're the middle person. Citizens, government, as well as the liquor industry need to play ball to come up with solutions. Are we having honest conversations around the harmful effects of alcohol in the country?
Well, I think first of all, let me say that the blunt tool that the industry doesn't want to have in place, and of course sometimes, even me, who I'm the guy that's been for the last 10 years fighting for jobs, even me said, listen, we've got to protect these beds. We need to use this blunt tool for 14 days. As much damage as it does to the economy, we have to protect it. But what it did to us is it really showed that, there are mechanisms of reducing harm, alcohol abuse that's linked to our trauma. Because, across South Africa, we saw, specifically during the new year, we saw, open, very quiet trauma units during New Year. And of course, what was the driver? So this says to me, there's an opportunity here to say, how do we work together? But, obviously, as you're listening, no one supports these blunt tools because that doesn't really get us to where we need to. We need to be where we have behavior change, where we're actually protecting our hospital beds, protecting jobs at the same time. We as government have a tool, it's called regulation. I think it takes too long to get our laws changed. And I've actually asked, people want to keep on adding and adding. I think, as Prof. Perry said, there's quite a few suggestions in this legislation right now. Let's get it into public comment and let's actually get it going as quickly as possible. What I would like to see us probably on the back of that, getting the next round so that we learn. There's no perfect science to this. There's regulation for liquor around the world. No, I don't think anybody's got it perfectly right. We do see countries that have got alcohol abuse to reduce. We need to learn. We need to apply it to our own environment. And as you heard right from the beginning, we've got such a diverse environment around liquor and liquor trading and licensed versus unlicensed. But at the end of the day, we've got abuse of alcohol that ends up fueling crime. It ends up fueling gender-based violence. It ends up, in our hospitals. And of course, that abuse of alcohol, we've got to try and manage. I don't think that a regulatory environment is the only way. We've got to find a way that lever helps us also get behavior change. And I think the second opportunity that's come about now is specifically the blunt tool of lockdown has really caused us all to come to the table. So now suddenly the industry are saying, we don't want another lockdown. So I think that says to the industry, well, what are the other responsibilities that the industry will bring to the table? Because of course, I don't want to do that as a government. And I think it's created a new opportunity. But the missing link here is the citizens. You've got many citizens who will say, but hang on a second, we are responsible citizens. But it's how do we influence that irresponsible use and that irresponsible abuse that ends up in trauma and in costing the state a lot of money. So I think there's huge opportunity right now. And if we can work together, let's get this first round in, let's try and test, let's put in the comment space, let's allow comment to be brought in. And let's work through this. I think we've got a huge opportunity right now.
Premier Alan Winde, stay with us. Adult per capita consumption of absolute alcohol in the country at 64.6 grams per day, the sixth highest in the world. That's something we'll talk about when we continue next. Are the alcohol controls still valid? Do we need an update on the alcohol strategies? To be a part of the conversation, tweet us at Newsroom405. WhatsApp your questions and comments to 072 110 5584. The Newsfeed Late Night returns in a moment. You're back with the Newsfeed Late Night. Joining us tonight in conversation, the Premier of the Western Cape, Alan Winde, alcohol industry representative Lucky Ntimane, and Director of the Alcohol, Tobacco and Other Drug Research Unit at the South African Medical Research Council, Professor Charles Perry. You're a part of the conversation with us tonight on Twitter at Newsroom405. That's where you can tag us. Otherwise, send us your WhatsApp questions and comments to 072 110 5584. We'll take those in just a moment as we run through some of the strategies and some of the proposals that are being put in place. A complete change as far as our controls are concerned, Prof. Perry, is that the way to go? Or are the controls in place right now still valid?
No, I think we need to look for doing something differently. And we also need, obviously, better enforcement. And so it's been very encouraging to see some of the ideas of the Premier, and I've got a few others to add. I mean, he wants to get on top of licensing, relook at that. And certainly I'd like to see perhaps license fees changed according to the volume of alcohol sold. So those outlets that are selling more, pay more, because they all currently pay about 4,000 to 5,000 rand for a license. And certainly a big macro or ultra liquors, I think, should be paying a lot more, and that money could go towards inspectors and things like that. We also have to talk about things that the Premier has also mentioned, like being able to track and trace illicit alcohol better. And there are ideas, things that have been tried in other countries like Russia, which could work with QR codes. And I know the Premier is also looking at minimum unit pricing, because one of the problems is the very cheap alcohol. People buying alcohol for under 5 rand a standard unit. And that's, our research has shown a link between price and things like that and harmful drinking. So certainly other countries also have shown that addressing the very cheap alcohol also helps to contain the problematic behavior. So yeah, some of those ideas, I think, are things we really need to look at, perhaps more controls on marketing, and also maybe look particularly at high-risk venues and times of day, things like that.
Yeah. When you were on the last time, this is the issue that you raised. You're of the view, for example, that outlets in the townships are selling per unit of alcohol at a very cheap price, and that speaks to the availability question. Do you still have that view?
Yeah, I mean, I did find out that a quart of beer is about 16 rand in the Tavern. And I think there's a place, if we instituted a 7 rand minimum per standard unit of alcohol, then that quart of beer would go up to, you wouldn't be able to sell it for less than 19 rand 25. So it's a small increase, but I think research, you're going to see something. There's a paper coming out in the South African Medical Journal in the next month or two. It's been approved, which looks at the effectiveness of minimum unit pricing in addressing heavy drinking. And I've got a doctoral student who's got a paper under review looking particularly at the link between minimum unit pricing and socioeconomic level and a level of drinking, and showing that minimum unit pricing does hit everybody. The heavy drinkers
minimum unit pricing is something that was implemented in Russia They started it on vodka first, and was later introduced to all the other alcohol beverages. And you introduce it as a policy, and you increase it on a yearly basis or whatever time you want to increase it. Is that the understanding?
Well, I think it's like in the UK. I mean, in Scotland, I think it's set at 50 pence per. You can't buy alcohol. That's a minimum floor price. Obviously, mostly in on-consumption outlets, it's well above that price. You're not buying alcohol for that price in restaurants. Even in taverns, they might only have to increase slightly. But it doesn't necessarily have to increase every year. That's what excise tax will do. So I think you set a minimum unit price, and you maybe change it if it needs to, but it doesn't have to change. Obviously, with inflation, it might need to change. So yeah, that was one of the strategies in Russia, also looking at marketing and also looking at hours of sale in high-risk locations. They reduced the hours of sale, and they also had these ways to track and trace illicit alcohol. So it would get scanned everywhere down the system, from the manufacturer to the first place it's sold to the wholesaler, and then it goes out to the retailer. And there's a scanning barcodes or QR codes, which would make sure that it was a legitimate sale. So if the police came across some alcohol being sold in an outlet which wasn't licensed, they could work where it came from. And talking with Lucky, I don't think he was resistant to the idea, but he did raise issues around the fact that many taverns don't have the infrastructure. Some of them don't have Wi-Fi. They don't have till points. So it might need to be brought in with other measures, such as upskilling taverns to enable to have the technology. So it could also be linked to an upgrading of taverns, which could be probably paid for by government as well.
All right. Lucky, critique for us then the proposals in place. One from the Premier, the raising of licensing fees. I know the tavern owner where you visited was concerned, particularly around this issue of raising licensing fees. Well, I suppose he was talking in the context of the lockdowns where he was unable to meet those obligations. And he says, when you don't meet those obligations, then they shut you down. Then the next day you see a huge outlet or retailer coming into your township, selling you literally out of business. What is your critique of the raising of the licensing fees, but also the minimum unit pricing policy?
I think specific to the Premier's proposals, we have an engagement set down for the 3rd of March, and I will not want to compromise those engagements by making public pronouncements tonight here. So with due respect, I would like to just leave maybe that conversation to take place on the 3rd of March, and then I will be able to give feedback once I get a green light from the Premier that I could share those details of the conversation. But with regards to the unit pricing, I think Prof knows our views in that regard as liquor traders. But I think this being a policy position, it is something that will need to be taken up at the total alcohol industry level. I don't think that this platform provides for a rigorous debate around that approach. We understand the countries that the Prof has mentioned, Russia and UK, and we like to believe that the socio-economic conditions of South Africa are different to those. So that's something that will also need to be taken into consideration when those discussions are had at the right platform. But policy deliberations cannot really be had in this type of platform. But I must add and emphasize this strongly, that the objective that Charles Perry wants to reach with his proposals are similar to what we want to reach, and which is to ensure that we've got a responsible trading environment that safeguards the issue of alcohol and ensures that people do not abuse alcohol. So we are 100% in agreement with regards to that. I think the only difference is the approach and the process that gives rise to those objectives being met.
Right. There are some retailers or outlet owners who are actually listening to this conversation tonight. They've sent in WhatsApp thoughts and comments on this. Let's go there and hear what they are suggesting. I'm in the liquor industry, and if I were to be asked, trading hours should be kept as they are now for taverns, 10 a.m. to 10 p.m. There is no responsible drinking after 10. That's James. And from T-Man saying, alcohol outlets are the only entertainment venues in poor communities. Kids from poor communities are exposed to alcohol at an early age compared to those who live in the developed communities. So, Lucky, that speaks to two issues, which are part of what is being suggested. One is to limit the hours of trade, particularly for off-site consumption as well as on-site consumption. But the second one is the involvement of the community view in the licensing of outlets. You hear there one of the WhatsApp comments saying, well, these outlets are opened in communities and our children are exposed to these at an earlier age. Which will tell you that the community would like to have a view around which outlets or what the density of the outlets should be certainly opened in those communities.
Yes, Babandluli. So in the liquor application process, communities do have a view, they do make input towards whether the license gets granted or not. So the community involvement is there. The liquor license regulations across all the 9 provinces make provision for that to take place. But also, let me hasten to add that, in my engagement with the Prof, we looked at an issue of the shebeens, which continues to be a nonsense. We feel that the best solution for us to move ahead, and really ensure that we regulate that sector, it is to give licenses to those shebeens that qualify, that have got the infrastructure that qualifies them to be taverns. You rather have more liquor traders that are licensed and comply with the laws than have shebeens that have proven to be nonsense during this lockdown because they have no law to abide with. They trade for 24 hours. They're not consistent. They're not contributing towards the safe trading environment that we advocate for. So we feel that those that have got the infrastructure and can qualify to get licenses should be fast-tracked and get licenses. We need to have those.
Would that not be counter to the argument of availability? Because now you're adding more licensed outlets per density of the community.
We can have 1 million taverns in the country if they operate in a responsible manner and contribute positively to the South African economy. That is not a problem. The problem is the irresponsible selling of alcohol, the irresponsible trading that we need to cap. That is the problem, not the density.
Prof. Perry, you agree with that?
Well, a lot's been said. Firstly, I think we do need to look at, and I've said this for a long time, we need to look at bringing more liquor, unlicensed outlets into the regulated market. But we do need to look at densities. I mean, that is a factor. The more availability in the area, certainly from a research point of view, it shows it's more problematic. But obviously, so we need to deal with the unlicensed part. Some of them will never get a license, and we need to try and, through various ways, get people to find other livelihoods for those establishments that don't have toilets, that aren't going to operate in a way that can possibly be responsible. But I agree with Lucky that certainly we need to look at instead of having 60-70% of the outlets in certain areas, even more unlicensed, we need to have more in the regulated market. So that is part of the solution.
Premier, alcohol policy, when you look at that and you look at our public health policy as well, do the two speak to one another? Do alcohol control policies work?
Well, I must say that I've spent quite a lot of time in our provincial legislature, in opposition and in government. I remember it took us a long time to get this first piece of legislation around licensing in place. And we don't always get it right with aligning the policy to the actual regulation. And then definitely, the reality on the ground, as you've just heard from this conversation, from licensed versus unlicensed. I mean, to try and get those things right, there's lots of ideas, but I don't think we test them often enough. But I must say that I think this next round, we've got some really good ideas, and there's still some more stuff that's not even in there that hopefully I can still add in. I think that what COVID-19 has taught us, specifically on using our measurement tools, in this province, we've got our 5 hospitals that measure trauma. And I've even seen Prof. Perry's emails every now and again copied off to our head of Department of Health. And now we're going to be measuring it in 20 of our hospitals. But also there's questions about what else should we be asking? What else should we be measuring? Because I'm sure there's other things. I mean, I think we should be asking a question about last round. I know that in New Zealand they have regulation about last round. So where were you when you were served too much alcohol, and then where were you when you got in your car and drove home? And is there commonality in the number of cases ending up in our hospitals that actually say the same street or the same place? Because then that means we've got to zoom in and focus on that heat map. So I think we've learned a lot around data and asking the right questions. We need to build that into our systems of measurement. And I also think the whole science around behavior change. I mean, there needs to be incentives, I think, in the system. And there also needs to be punitive measures. So I think hours of trade are a lever that we don't use enough. And I think the blunt tools that we've learned in this round of managing COVID-19 have said, okay, well, maybe we need to have harsher tools that will probably end up giving us better behavioral change and more responsibility from ownership of trading to say, listen, I'm responsible for my clients. And if I don't take that responsibility seriously, I have implications for my business and the sustainability of my business, because the punitive measures are too harsh for me to remain in business. So I must become more responsible as a trader. And then, of course, for me, at the end of the day, what are those levers around behavior change amongst users, which is much more difficult. But let's not shy away from these difficult things. Let's try things, and let's see if we can get that behavior change right.
Premier, appreciate it. Stay with us. We'll continue in a moment. Prof. Perry, as well as Lakintimane, still a part of the conversation. Tag us at Newsroom 405. WhatsApp your questions and comments to 072-110-5584. We'll come back in a moment, and we ask the question, what else can actually be done, particularly when we are talking real-time tracking at production level, but also at the point of sale? And how do you sift out the irresponsible retailers? Put those questions to our panel in a moment. Stay with us. We're back with you on the Newsfeed Late Night, and our conversation continues with the Western Cape Premier, Alan Winde, the alcohol industry representative, Lakintimane, and director of the Alcohol, Tobacco and Other Drug Research Unit at the South African Medical Research Council, Professor Charles Perry. We invite you as well to be a part of this conversation at Newsroom 405. WhatsApp your questions and comments to 072-110-5584. Prof. Perry, what the Premier mentions is that we've had these measuring tools in place, like measurement of trauma, for example, and so on and so forth. My question is, when was the last time did we actually do a quality assessment of the systematic review of alcohol control interventions?
Yeah, I mean, it's done in various ways, but it's not done systematically. So I was very pleased in 2019, the Medical Research Council got a contract from the Premier's office to develop indicators for the implementation of the Western Cape's alcohol harm reduction strategy. So those tools have been developed. They were based on a scoping of the international literature, looking at what other countries used, meetings that I've been a part of with the World Health Organization, and sitting down with people at the coalface in the Western Cape to look at what tools. And certainly we have those tools, and I think the Premier is 100% spot on. We need, if you can't measure it, you can't see how well you're doing and how you need to change it. And I think one of the things I've been pushing into his colleagues is we need better data on alcohol-related trauma. And there's something you can use called an alco stick measure. It's like a finger prick test like you do for blood glucose. And we could do that on everybody coming to trauma units in those 5 hospitals, or if it's expanded to 20. And then I think we'd have a better idea of the alcohol relatedness of trauma. And I think it'd be a good measure of the burden of alcohol on the healthcare system, and also a good measure of how we're doing as a province in terms of implementing a range of strategies if we see this level of alcohol-related trauma coming down. So my challenge to the Premier is, if I was in his shoes, I would implement this right away. I also think he mentioned sort of the carrot and stick approach, and I think that's excellent. And certainly we could probably also look at increasing license fees for those traders who had compliance notices or complaints against them, so that it becomes an incentive to trade responsibly, because then you might even have a drop in your license fee. But if there are complaints against you and so on, your license fee goes up. So I think there's a whole lot of sensible initiatives that can be undertaken. But certainly I would say we do need better measurement of the burden of harm and how well we're doing, and how, the level of harm from motor vehicle accidents, alcohol poisonings, and so on.
Right. Lucky, there's some more suggestions, but here's a question for you to start off. How do we deal with the culture of drinking to intoxication levels, right? There's a heavy episodic and binge drinking that's become a normative in our country, and that is a real challenge. But two, how do we deal with adolescent drinking, and how do we bring down the level of alcohol dependency in the country? In fact, it is estimated that people who depend on alcohol in South Africa are 3 times more than the average for the World Health Organization Afro region, and globally, we are the second highest country.
Babu Mdluli, those are valid and important questions that we must not shy away from. And it is for that reason that we seek dialogue with eminent professors like Charles Perry so that we can find solutions to those problems. But we know that aware.org, the organization that is fully funded by the alcohol industry, has got programs that tackle the issue of underage drinking, binge drinking, as well as drink and drive, amongst the whole range of offerings that they have. But I think what we need to do is to dial up these programs and ensure that they are almost high impactful on the ground, and not just something that happens in a particular area, but something that filters down through the entire 9 provinces of the country. We've got programs in place, but I think more can be done in terms of finding other means and ways that will ensure that we drive this issue as a behavioral change program that ensures that we are able to see the results. We cannot continue as a country to have this bad relationship that some of us seem to have with alcohol. A solution needs to be found. It needs to be found very fast. And I need to emphasize that we agree with the Prof. Perry assessment around incentivizing those that comply with COVID-19 regulations, but as well as license conditions, that those that comply need to get the benefit of that in terms of having a reduced license fee payable. We feel that will make a difference. But also we have a proposal to make to say that those that do not comply need to face hefty fines. We saw an incident in East London where the outlet owner was fined 5,000 rand. We feel that is a slap in the wrist. Those people ought to even lose their license as a worst case scenario, but they need to be fined a lot of money so that this deters other people that feel that paying 5,000 rand doesn't really affect them. They can even make that 5,000 rand in 30 minutes. Those are people that we do not need as a country. Those liquor traders ought to be out of business because they're not helping in supporting government's efforts in fighting against COVID-19 pandemic. For us is to ensure that we continue to support the issue of lives as well as livelihoods, and those people continue to compromise us, and we cannot have them in the system.
But the real challenge, is that they are in the system. That particular one happens to have been put on social media. If it wasn't, we would not have known. Even the 5,000 fine or whatever fine that was put in place would not have happened. So my question to you is, how do we track those who are illegitimately selling as well, but also who are just breaking the rules of engagement here as far as what we are trying to achieve?
We currently have a program running that's called Tavern Compliance, focus groups. That's focusing on 5 key hotspot areas across the country. Those are provinces. And we are able to identify outlets that are not complying and take them through a training program. And if they continue to misbehave, we report them to the relevant authorities for them to face the might of the law. So we are not sitting in a corner and hoping that things will work on their own, but we are doing something about it to ensure that we change behavior. We encourage these liquor traders to do the right thing and trade in a responsible manner, because you can imagine that if a liquor trader is not trading responsibly, it means that the consumers that are linked to that outlet are not going to also behave. So it's important for us as liquor traders, in partnership with liquor manufacturers, to ensure that we have a total responsible trading environment that further supports the health sector in how we act, in how we do things.
What are the liquor traders and liquor manufacturers saying about the tracking and the tracing? So you track at production level, whenever a bottle is produced, that has a tag, it has a QR code, and wherever it's sold, we are able to pick up that QR code. Even if it was a last round sale, we're able to pick that up and understand the movement and the journey of this bottle.
I haven't been party to those discussions that the liquor manufacturers might have had around that space. Suffice to say that I've had those engagements with Prof. Perry. And once there is a view from the liquor manufacturers, we'll be more than happy to share.
All right. Here's a question directly to you, sent to us on WhatsApp, what people would like to get as an answer from you. Lucky is against the total ban on alcohol in the event of a third wave. Can he tell us how they intend to control an intoxicated person to wear a mask, wash hands, and social distance? That's anonymous. And let's take another one.
I think...
This one says, does making alcohol cheaper reduce the consumption of alcohol? That's Dams. Let me take a final one and I'll get you to respond. Hlala Benza, saying law enforcement and behavioral change should be prioritized more than a complete shutdown of liquor, which we'll all know affects our economy in terms of employment and tax revenue. And Premier, I'd like you to also take that one as well. Okay, Lucky, you can go for it. You can answer to all three.
I think the issue of masks, the government has pronounced heavily on that, in a sense that it has now been made a criminal offense not to wear masks. So that is a responsibility for all citizens of the country to ensure that they wear masks, whether they're at a tavern or they're at the supermarket. So for us as liquor traders, what we can do is ensure that people that come into a place of trade are sanitized, they observe social distancing, and that they're wearing masks. Failure to comply with that will mean that the outlet owner will have to unfortunately kick that patron out so that we can maintain the safe trading of alcohol. I think the other issue in terms of whether cheap alcohol reduce consumption patterns, I think Prof will be best suited to answer that.
All right. And Premier, law enforcement should be prioritized as far as compliance is concerned, more than a complete ban. What is your view?
Okay, so absolutely. I mean, we need more policemen and women in our region. I mean, we've got high crime rates. And of course, we need to, this alcohol is linked to that crime. We're putting many more boots on the ground as a province. We're doing that through local law enforcement. I think we actually need far more liquor inspectors as well. But I think this links to the point also about consequences and traceability. So we've already got in our wine industry, in order to compete in the global market, we've got really great traceability systems. So we can work out where that wine, where the grapes were grown, in which field or which vineyard, which winery it went through, which transport system it went through, and how it ended up in a market somewhere on the other side of the world. And we need to use that exact same system and tools, as the Prof says, is how can we track it and trace it to whichever level we can now. And then, of course, wherever those gaps are, if there's a gap between where we've got the ability to read the QR code and Wi-Fi connectivity, that must be overlaid with our other tracking and tracing systems, our hospital measurement systems, developing those heat maps, and then there must be consequences. So we must be able to, I agree, we must be able to push law enforcement into those areas where we see where those heat maps are. And I think also, even as Lucky said, there should be consequences that actually are tough and that actually make people think twice before they want to allow any of this abuse to happen, because they know that it's going to lose their license. They're not actually going to be able to get alcohol. But I also want to say that our existing regulations, some of those laws already exist. We already have in our legislation, if a wholesaler is supplying to an illegal outlet, the consequences are there for the wholesaler. But I think also, I don't think we have sufficient law enforcement that polices that through. And I think that's also going to be brought into this new regulatory change. So we must actually ask ourselves the questions, the existing pieces of legislation, where are they not working, and what should we do to tweak them to make sure that they work better? And then, of course, as we've said, let's bring some of these new ideas into the legislation as well that will help us, because that's one of the tools we have, which is regulation. But then again, I say it over and over again, we've also got to make sure that these are rules and regulations that influence the marketplace, but also at the end of the day, I think absolutely influence through education, through consequences, influence behavior change. We've also got our fines in our existing legislation are supposed to be channeled through education programs to help change. I don't think they're sufficient enough, and I don't think they are really having consequences or outcomes, should I rather say. And so we need to relook at that as well. What kind of education programs are there in place? How is it funded? And it should be funded out of the fines and the consequences. But I think we've also got to review that, because if we look, you've quoted some of the alcohol consumption numbers. I mean, it's astronomical. And so are our tools working? And I want to say right now, insufficiently. And that's why we've got to bring in new and try new things. And we've got to do them regularly, measure them. And then if they work, we'll, of course, celebrate it. If they don't, we've got to come again and try it again.
We continue in a moment looking at the specific interventions in the short term, the medium term, as well as the long term to curb the harmful effects of the use of alcohol in South Africa. To be a part of the conversation, we'll take some more of your thoughts at Newsroom 405. WhatsApp us your questions and comments, 072 110 5584. Do stay with us. We're back in a moment. The Newsfeed Late Night continues. Joining us in conversation tonight, the Premier of the Western Cape, Alan Winde, the alcohol industry representative, like Intimane, and Director of the Alcohol, Tobacco and Other Drug Research Unit at the South African Medical Research Council, Professor Charles Perry. This follows, of course, a dialogue that happened between the two, and there is another one we hear tonight planned for the 3rd of March between the Premier as well as the alcohol industry. You are part of this conversation at Newsroom 405, and you're sending us WhatsApp questions and comments on 072-110-5584. Let's go straight to one of the comments that are coming through tonight on WhatsApp. Let's have a look. This one from Anonymous saying, government must leave our beer. We are a responsible society. The government cannot cripple the SAB. The industry is contributing much to the economy. The industry and government cannot afford a complete lockdown of beer. Lucky, let's talk about this. I mean, you mentioned earlier on that it would be better to have 1 million licensed shebeens than to have those who are operating unlicensed. I mean, part of what you're saying is because you're very closer to that economy and you're very closer to those traders. A suggestion being raised on support for these outlets to sell other products and pursue other alternative income generation, especially those who are home-based, who are unlicensed, who have no possibility of ever meeting the license requirements.
Indeed, Tabo, we feel that that is a fair proposal, something that we should look at very seriously. Some of our liquor traders that were able to survive the lockdown, Tabo, was because of the way in which their outlets are structured in terms of being able to offer other products that are non-alcoholic. Some had spaza shops that were linked into their premises, and they were able to continue to support their families. So yes, indeed, we feel that liquor traders that will not stand a chance to get a license based on the conditions or the infrastructure should look at other means of generating income to support their families other than alcohol. So I think alcohol is, it's a very specific product that requires those that have the right infrastructure, they've got the right mentality, and they've got the right frame of mind, to deal in this special product to come into the space. Alcohol should not be used as a shortcut to anyone who wants to make a living. This is a product that requires a responsibility on the side of the liquor trader. So yes, we feel that those that could look at elsewhere to earn a living should be encouraged to do so, and we should look at means and ways in which those are supported. We cannot leave anyone out of participating in the economy, even if they do not qualify to sell alcohol, but we should look at means that those are supported, whether they want to open spaza shops or hair salons, they should be fully supported, that they engage and be part of the economy going forward and not be left out because they do not qualify to sell alcohol.
Now, in terms of the concerns that you're raising around delivery of a bulk product to people without license, just give us an understanding of what your concerns are there.
So a person who does not have a license cannot order alcohol from a manufacturer. It's just an illegal exercise. People that are shebeens will buy their product from a distributor. And this is something that we discussed at length with Prof. To say we should be able to track, the movement of stock into the unlicensed trade, because you end up having a situation where off-premise is allowed to trade over a 4-day period. If an unlicensed outlet stocks up from you as a distributor, where is the stock going to end up? It's going to funnel the illicit trade that we are all trying to fight against. So ours is to ensure that we've got a regulated market. People comply with all the applicable laws that govern how we trade in liquor. But anyone who does not have a license does not have any regulation to fall back to, but they'll continue to do things in the wrong way and continue to put pressure on the legal system. We now have to defend people that do not have even licenses, do not even have a right to trade in alcohol. We have to defend their actions. A lot of the non-compliance comes from that space. Hence, our proposal is that those that qualify to have licenses should be moved quickly into that licensed environment. And those that do not qualify to get licenses should be dealt with at that level, whether it means that we need to look at ways in which those people can sell other products other than liquor because they do not qualify to sell liquor. So ours is really to advocate for a safe, responsible trading of alcohol, coupled with that, the self-consumption of alcohol.
Prof, let's talk about then the question that I raised earlier on of, we are dealing, I said first, the culture of drinking to the levels of intoxication, alcohol dependency. But here's the other issue. Alcohol dependency is linked, I suppose, to one of the pillars of the safer strategy by the World Health Organization, and that is to facilitate access to screening, brief interventions, and as well as treatment. Just broaden for us what exactly you envisage there in terms of the medication and the treatment that should be made available.
Yeah, so certainly there are 5 prongs to the WHO's safer strategy. We've been talking about availability, we're talking about pricing, we've talked about marketing, and drink driving is the 4th one. And the 5th one is screening and brief interventions for people who are struggling. And certainly that has been an issue that I've raised during the lockdown. We had the ban, the temporary sales ban, and there was no really initiative by government to look at people who might be struggling because they cannot get their alcohol. So certainly we need to look at ways to assess harmful drinking and dependency. It's called brief screening. You can use a tool which can even be as little as 4 questions, or the alcohol use disorders identification test, which is a 10-item screening instrument. And based upon your responses to that, you get an answer saying, well, look, the person doesn't have a problem, but you can just provide some education so that they know about risky situations. And then you get people in the middle end who are sometimes drinking at harmful levels, and then you can work with them to identify the triggers and work at preventing them drinking too much. And then you get people at the end of the spectrum who really are dependent on alcohol. They need it often first thing in the morning because they got withdrawal symptoms. They drink more than they want to. Other people get irritated by their behavior. And those people probably need some kind of inpatient treatment or medication. And certainly we didn't see enough help going to people during the pandemic, particularly during the 3 alcohol sales ban periods. We should have seen hotlines made available. We should have been encouraging people to go to the hospital facilities to be able to, they might even need medications such as anti-anxiety medication or naltrexone to help them deal with withdrawal. So certainly we need to look at those people, and probably we've got probably about 6% of the population have tendencies, adult populations, towards dependency. And so that's quite a lot of people who were struggling during the lockdown. And certainly I think we could do more to make screening and brief interventions available. That's something we certainly don't hear enough about. Yeah.
Speaking of tracking and tracing, Prof, here's a suggestion from one of the Twitter listeners, or viewers, shall I say, from Dr. Zania, saying citizens should get a limit on the amount of alcohol they can buy per year. And this should be done through an ID verification before purchase so that retailers and taverns can know not to sell to a person who has reached their limit. I mean, do we even have capacity to put a strategy like that in place?
I don't know if I would agree with that. I mean, it's the sort of situation you get sometimes when you go to some Islamic countries. Is for non-Muslims can get a quota of getting alcohol from certain stores. And I would rather we look at things like minimum unit pricing. People are very price sensitive. The World Health Organization's got something called the 3 best buys. And right at the top of the list there is pricing. Alcohol is very cheap. So I think we're not using that tool enough. Certainly, moderate drinkers and light drinkers are affected more by price, but certainly the research shows that heavy drinkers are substantially affected by price, and they do drink less. In fact, the paper that we've got under review looks at the benefits of implementing different pricing levels on alcohol in South Africa by drink type and by the socioeconomic status, and it's calculated over a 20-year period. The savings in terms of lives lost and the incidence of different kinds of illness conditions such as infectious diseases, heart attacks, and things like that. So I think we can show quite clearly from this modeling, we can predict what might happen if we increase the price. So I think that's a better strategy. You're going to have a situation if you have quotas that people who don't drink will then get their quota and they'll share it and sell it to other people. So I'm not sure. I don't think I'd go along with that strategy. I've never seen it being proposed, and certainly not an evidence-based strategy.
Right. Premier, let's talk about what the province can do at this point. For example, limit hours and days of weeks of sales. That's something that is already, I suppose, in place with the current emergency regulations or state of emergency that is in place. But is that something that you can immediately implement even when we return to out of the state of emergency?
So I think that's something else that we need to look at, how we can use it as a tool. I mean, as we said earlier, how do we use it as a punitive measure? And that's where I think it goes to last round and heat maps, because I also don't think it's about individual outlets. It's also about areas taking responsibility, or streets. Or so if a high street starts to become a hotspot that, hang on a second, this is a place where it goes until 2 o'clock in the morning, and the implications for our trauma and our car, motor vehicle crashes, etc., are huge. Then the measure is, well, because it is getting this, we will reduce the hours of trade down to 11 o'clock or whatever. And I see that more as a tool. But at the moment, I think it's quite an administrative burden. You do see some hours of trade changing between municipalities, and even days of trade changing between municipalities. And I think that's definitely something else that we must look at. We must ask ourselves those questions. I also think going forward, I mean, we're making suggestions as the province, how are we going to manage the third wave and the fourth wave? And we're using, I think, our learnings from the COVID-19 experience the last year is really driving a lot of this conversation, because suddenly it's got us around the table. And I think it is an opportunity for us to find tools that are much more responsive, and how do we actually enable them to work quicker? I think at the moment it takes too long, and it's, there's long processes of public comment. We need to find ways which says, hang on a second, this is what's happening in area A, and we are going to move in there. And from tomorrow night, the hours of trade are now restricted until 11 o'clock. And but we're going to have to take that through the regulatory process to allow us to do that.
Gentlemen, unfortunately, we are completely out of time, so we're going to have to leave it there for tonight. I appreciate you coming through tonight. Western Cape Premier Alan Winde, the alcohol industry representative, like in Dimane as always, Director of the Alcohol, Tobacco and Other Drug Research Unit at the South African Medical Research Council of Charles Perry. Thank you for your contribution tonight to this conversation.